Dear friends, allow me to introduce Dr. Ali Singhal, who will take over the podium for the first session. Dr. Ali Singhal is the director of Dubai Police Healthcare Center and is the technical and administrative supervisor of all the center's divisions and the clinics in Dubai. He is the award winner for the Dubai Government Excellence Program in 2009. Dr. Singhal has received more than 200 awards and certificates. Vitamins program is well known throughout the country, and Dr. Ali is the anchor for it. Welcome, Dr. Ali, and please take over the session.
بسم الله الرحمن الرحيم والصلاة والسلام على أشرف الخلق والمرسلين سيدنا محمد وعلى آله وصحبه أجمعين. Dear guests, we'd like to welcome our guest speakers as well on the stage. But before that, I'd like just to thank Dr. Watson for just sending us positive energies, because we as doctors do believe in positive energies and sending positive energies. Because when she mentioned the integration between heart and brain, because what we do, we believe that human body consists of two parts, body and soul. So in terms of terminology, then we are talking about physiology and psychology. But when Dr. Watson said heart sends messages to brain, because in medical field, what we think that, you know, we communicate through energy. We see each other through light energy. We listen to each other through voice energy. So basically, when we've got an energy, gets into our brain. So we've got certain secretions which affects our body. So when you're angry, then your body responds to anger. And when you are happy, your body responds to happiness. So I think my message to all of you as nurses, I just forgot to congratulate you on this special day, which is a nursing day. So my message as being a member of medical field as a doctor, if you can't smile to your patient, don't see him. So if you can't smile to your patient, don't see him. You're not forced to see a patient, but I think this is our duty. So let me just, I think we've got our professional guests here. I'm going to start with Dr. Mariam Miktibi. She's our first guest speaker. Now, she's a graduate of College of Health Sciences from Bahrain, Kingdom of Bahrain, and I think she obtained the Master of Business Administration from Arab Emirates University. She's one of our first national nurses, among our first national nurses, and she's got lots of experiences. I think now Ms. Mariam is a director of nursing care or nursing section at Zayed Higher Organization for Special Needs. I'd like to welcome Ms. Mariam Miktibi to talk about evidence-based practice, compatibility with nursing. We'd just like to welcome Ms. Mariam. You've got 15 minutes. Just 15 minutes. 5 minutes over.
Good morning, everybody. I think my voice now is very loud. First of all, I wish you actually a happy Nurses Day. Then, for today, actually, first of all, my gratitude actually, and thanks to ENA member for having me here as a guest speaker. I don't have models and theories actually to share it with you. I have just only some information about evidence-based, and I'm here also to listen actually and to have more idea about what's happening and what's new actually in the evidence-based practice. So I will go just only, maybe you will see me that I'm rushing a little bit, so just assume that there is tiger, running behind me, so I'm to finish within this 15 minutes. First of all, today, of course, we are celebrating the Nurses' Day under the theme of closing the gap from evidence to action. The concept, actually, it is not new for us, but it's moving actually quickly, and it is a new trend actually which we have to consider in our nursing profession, and we have to update our information and to know exactly what is lately is there in the literature and all that thing, and to have also the resources available for our nurses. Actually, what I'm going just to do today, I will be briefing you about the ICN, even though you know about the ICN, but I want to know just the latest information about them. And I'm going to emphasize on the 4 components of the closing the gap, the International Nurses Theme by ICN. This information actually which I'm adding to you, it is not a new thing. You know about the International Nursing, it's very famous international council. Just only to have some information about it, that it is presenting actually 130 National Nurses Association and INA among that. I don't want to market for INA, but believe me, I was searching about having a membership in a recognized council, just worldwide. So I just, I was just doing my search on the internet. I plugged in their site and I saw that, if you are going to be registered within any National Nursing Association, okay, so you are eligible to be a member in the ICN. So I don't know, maybe if the INA president, Mr. Abeid, he could just add something for that. I'm not doing any marketing, but if you are looking for something which is to be recognized, so it's better to go for and to be a member of INA.
If you're intending for marketing, I can help you.
Good. Thank you, Dr. Ali. It is founded in 1899. I will skip through quickly. Operated by nurses and leading nurses actually internationally. My introduction to the evidence-based practice, it's just only 2 words about the ICN. The rest is actually left for you to know about it more. First of all, regarding the evidence-based practice, in the 1980s, the evidence-based medicine, it's emerged to describe the approach that used scientific evidence to determine the best practice. Later, the term shifted to become evidence-based practice as clinicians, other than physician, okay, I'm not underestimating Dr. Ali here, recognize the importance of scientific, of course, evidence in the clinical decision-making. The evidence-based practice has become a prominent issue internationally, of course, in the healthcare, rising the cost, and we are looking for effective and efficient, of course, the healthcare provided for our patients. So for this reason, we are moving toward this new trend of having the evidence-based practice as a backup for us, to look for more information when we are introducing any kind of nursing care. Then as nursing, what we have done, we became actually involved. And this is what I like about the nurses, when there's something new is coming, so they are the first people who is jumping, into that, because they are the backbone of the health services, so they are the leading actually. I consider the nurses, they are leader. As nursing became involved in this movement, the quest to define best practice began after resulting in complex challenges that have no easy solution. The responsibility, of course, for the nurses, it's increased now. We are asking many questions. Are we doing and providing the right care for the patient or no? What is, where I'm going just to have a look for the information, from where I'm going to retrieve my information. So it was first component actually in the evidence care, in the evidence-based practice by ICN. They focused on 4 components. First of all, we have to understand the evidence-based actually. And I think we shifted now toward not even understanding, because the concept of defining it and all that thing, it's lagging behind a little bit. If you are agree with me, so I think, because most of you now, maybe before 3 or 4 years, we are just being, knowing about evidence-based practice and definition and all that thing. So I will skip part of that thing, but we have to understand it through the appropriate definition, and we could apply the elements of evidence-based practice actually to know if this is the appropriate one, the best available of evidence. We have to determine that. Then the need and the preference to the health services. Is it useful for us to apply this evidence-based practice? Is it the environment ready for us to do that? Then the nurses' expertise and the skill and the clinical judgment, it's also involved in that. We will continue with understanding the evidence-based practice. We have to have a systematic review actually for our action. And it's done actually through revising our policies and procedure. This is an example of what we are doing. This is actually the heavily used trend of evidence-based practice when we are applying to our policies, and we are revising it maybe twice a year. And here when we are going back to the literature review and doing all that search, just to have the information and adding up to our practices. Of course, we have to formulate the clear problem actually, or question what exactly we want. Or the problem, it should be defined very clearly. Is it the problem with the hand washing, is the fall down? What is the problem? We have to be very clear about it. Then the use of the comprehensive search. Of course, we will come across, and I'm having many of the guest speakers, they will speak about the source. And also I'm rushed a little bit because I don't want to repeat and overlap, with the other presentation, because when we are just talking about the evidence-based practice, it seems that we are going and repeating the concepts over and over. We have to have we have to use, as I mentioned, comprehensive search. We have to have clear criteria about what to include and not, or to exclude, systematic grading of quality research, and abstraction of data. Then the source of the evidence-based practice, and I think it will be emphasized clearly now by one of our guest speakers. And I think it's for all of us, it's very clear actually. It is either, it should be, it is a research by health professional or academics, research by companies or pharmaceutical companies, review research and clinical guideline, expert opinion of colleagues, clinical experience and the experience of patients themselves and the carers of the client. And the clinical audit data, it could be also. And also we have to consider if the evidence is good enough to be used or not. So this is the 3 components which we could apply to that, to test actually if the evidence is appropriate for us or if it is good enough. Is the evidence good enough? The quality to use? What does the evidence mean to the patient and for the client? Are the findings amplified a care, for example? So what we are, and I'm as a leader, I'm just only assessing my factor. The factors for establishing that one. So I will just raise this question. I have to take into consideration political factors, economic, and ethical. I have to consider all that when I'm just introducing the change to my nursing practice. There are some ways actually to foster the evidence-based practice, and it is by building the partnership. The first, I think, partnership I would just only to collaborate with is Jane to do that. Using champion, the change agents, sharing and disseminating the information. I think we have to work a little bit in this one, in sharing and disseminating the information actually. I left the MOH and now they said that you left the MOH, so I feel like detached, we have just to go back for disseminating the information, and doing that we have just to be attached with the Minister of Health. Just going back and continue my thing. Educational and training intervention, mainly for our nurses, and standardizing the practices. It is by policies and procedure and all that on hand. Now we have to make the case for change. The third, the final actually component of the closing the gap. I put it as a question, you know, if we could answer this question, it's very good. So we are asking ourselves, you know, and it's very helpful in preparing a case detail. First of all, what's the different options being compared? What we are comparing? I'm having certain practice, I want to compare it to someone, to something else. So what kind of different option I'm having? What are the most important potential outcomes of the options being compared? What is the likely impact of the option? If I select this option, what is the impact? I have just to be careful, okay? So, and take the full responsibility. If I want to apply something, to know that there will be some impact of that. Is the a formal economic analysis, which I have done it will help my decision making. We have to take into consideration also that thing. Because, you know, sustained of economic and financial resources, it will sustain and it will back up my decision making in the practice itself. And all of you, I think, the leaders, they are introducing something new, but at maybe 1 year, and we're saying, okay, we are not going to do that because we don't have the finance. And this is the issue, finance, and we are lacking the finance. And is there any capacity to implement the change and make the system stronger? And finally, what is the extent of leadership support? And I think one of the guest speakers also, they are going just to pinpoint on this thing because it's very important. Without the leader support, you will not get further more in whatever, specifically in our nursing profession. So we have to have the leader support. Of course, I came to an end, actually. I'm wrapping up my presentation, and I hope that I stick to the time, because nobody gave me 5 minutes, you know, notification.
3 minutes. Got another 3 minutes.
Okay, I finished, actually. And also at the end, I wish you actually a happy Nurses Day, and just reminding you of the International Nurses Team. It is the closing the gap for from evidence to action. And first of all, we have to understand the evidence-based practice. We have to identify the sources, and I hope that we could make it stronger for us. And also, from evidence to action, we have, since we are having all the elements to support our evidence, now we are going to take it into the action. Then at last, please. So making the change making the case for change. And thank you very much.
Thank you very much, Libby, for the great talk. It's very important to have evidence-based practice in all fields. So our next guest speaker is Dr. Aida. She's obtained a bachelor, master, PhD from different universities. Now she's more into academic work. She's visiting professor of different universities. She has lots of publications as well. Hello. She's into research, workshops. I think we need to ask her a lot. Now, the thing is, lots of people ask, what is evidence-based practice, or what is evidence-based nursing? So to know more about it, and to know how it was developed, I think I'm going to allow Dr. Aida to tell us. Welcome, Dr. Aida. Thank you.
Like everyone else, I want to say Happy Nurses Day. I want to also thank you very much for the opportunity to come and speak today. I first spoke at International Nurses Day here in Abu Dhabi 12 years ago. I had just been appointed 2 days earlier as the first director of nursing at the School of Nursing at the University of Sharjah. And I was invited to come and tell people all about our program. I did. Many of you came to that program, and it's still going strong. So thanks for the opportunity to come back 12 years later and speak about a different topic. I have been asked, because I am from McMaster University, to speak about the origins of evidence-based nursing and evidence-based medicine. Now I've got to figure out how to. So these are the objectives I was given. Define and describe the evolution, describe its origins, highlight the importance and implications, review some of the challenges, and finally, I'm going to veer off a bit and talk about what has become the newest term that we're using at McMaster, and I think it's moving globally, and that is the notion of evidence-informed practice, because it is a broader term, and I will spend the last few moments of my talk speaking about that. So first of all, I thought for those of you in the audience who might not know Canada, this is Canada. And I don't have a pointer here, but somewhere down there you see Toronto on one of the Great Lakes. And just down the road from Toronto is Hamilton, and in Hamilton is McMaster University. And here is the building where evidence-based nursing and evidence-based practice were first talked about. It looks like a factory, but in actual fact, it's a hospital, and inside are many offices as well as the hospital. So this term was first used in 1991 by Gordon Guyatt. Someone else in the audience and I both worked with Gordon Guyatt. He was one of a number of very young, very bright physicians, epidemiologists who came together at the university as the medical school was evolving, as the nursing school was evolving. Research was just burgeoning in both medicine and in nursing, just exploding. So it became very sensible to combine these two notions of clinical expertise and the new research that was coming out to be able to provide the best care to individual patients. And just to let you know, this is Gordon Guyatt. There were two major influential factors in the development of evidence-based medicine and why it evolved at McMaster. First, McMaster is also well known for an educational approach that goes away from rote learning to teamwork, self-directed, critical inquiry, very involved, active learning by nurses and physicians at McMaster. I note here critical inquiry. So the important notion was that students are presented with an issue, a scenario, they go off, they discuss, they determine what they need to know, they go and get the very best possible information, they come back and talk about applying it to their patient situation. At the same time, partly because of bright young minds, partly because of computers and the availability of patients and the energy of the time, there had been great advancements in randomized clinical trials and systematic reviews, both quantitative, very vigorous approaches to research. And because these two things happened, it seemed very small step to introduce evidence-based medicine. Use this research, use inquiry, apply it along with clinical expertise to patient care. Evidence-based nursing evolved from evidence-based medicine. And the early work differentiated evidence-based nursing from evidence-based medicine and really focused on the barriers to care. Two people on our faculty, two, again, bright young women, were very much involved with the gentlemen in the Department of Medicine in terms of research. And so it became a very natural thing to move and take evidence-based medicine and apply it to nursing. The two people are Donna Saliska and Alba DeCenzo, who also worked with a third person, Nikki Cullum, and they have developed the journal Evidence-Based Nursing, which I'll return to later. And just so you know what they look like, here's Donna Saliska, and here's Alba DeCenzo. Now, how has evidence-based nursing evolved? First of all, evidence-based medicine, and medicine in general, still tends to look at the individual patient. Evidence-based nursing looks at the individual patient, I should say the family, and also communities. So it uses an evidence base to plan, provide, affect policy at all levels. Secondly, evidence-based medicine relies primarily on randomized trials and systematic reviews, very quantitative approaches to research, whereas evidence-based nursing incorporates qualitative studies, which, as you know, focus very much on the patient's experiences, their attitudes, their beliefs. Very congruent with what we just heard from Dr. Watson. Now, when we talk about evidence-based nursing, often we're putting a lot of emphasis on the notion of the research evidence. But